As cardiovascular disease rises globally, innovative solutions from China, like those developed at the Xiamen Cardiovascular Hospital, offer hope for Jamaica to transform its healthcare system and save lives. Marlon Samuels explains in this week's Living Healthy report.
Xiamen Cardiovascular Hospital, located in China, is a world leader in advanced heart and vascular care. It's helping China combat its growing cardiovascular disease burden with cutting-edge technology and innovative treatments.
We do a lot of new innovation technique to do a lot of complicated case. We think in the last several years, maybe 10 years ago, we never think about this kind of patients can be cured with this device. But now with the aging problem, with the aging people, more and more structural heart disease becomes a severe problem. We use minimal invasive treatment, a lot of our local device to treat. We achieve a very good result. For example, we can use a robot system, a robot device, use a machine to do the operation. I control the machine, manipulate the machine outside the operation room. The operation room is empty and I can do it finished outside. And I can also finish the operation remote in another country to control operation. I think this is the future of our device, of our system. It's the future of use a robot system to finish all the operation.
This hospital utilizes minimal invasive procedures and artificial intelligence to diagnose and treat heart conditions more accurately and efficiently, saving lives and reducing costs.
Yeah, AI is very good used in our hospital. We have a lot of outpatients, inpatients. We can use the AI to help us a lot. For example, we can use a lot of AI to help us to type the medical record without the doctor. The AI can help us. You can only talk with the patients. You can only do anything, but without typing or write something. It automatically forms the medical record. So all this is good. Save a lot of time for doctor, for the nurse.
Now, these breakthroughs have the potential to benefit Jamaica. Over 7,000 Jamaicans die from cardiovascular-related diseases annually, making it the leading cause of death in the country. Jamaica faces a critical need for accessible, affordable, and advanced care. Integrating these innovative solutions into Jamaica's healthcare system could improve early diagnosis, reduce complications, and save countless lives, building a stronger, healthier nation.
Special interesting case yesterday, we repair his mitral valve and his tricuspid valve. It's a severe disease patient. It's a lot of symptoms. And after I treated yesterday, he almost can discharge today. He feels very better. The patient's already 75 years ago. He can't tolerate open heart. So the minimal repair system can help the patients. It's a very good.
Is cardiovascular disease a major problem in the world?
Yes, cardiovascular is a major problem not only in China, but it's also in the world. It's a major problem. Every 5 died patients, around 2 died of cardiovascular disease.
By adopting these global advancements, Jamaica can expand access to world-class heart care and make a real difference in the fight against cardiovascular disease. What's happening at the Xiamen Cardiovascular Hospital in China today can help Jamaica tomorrow to create a healthier future for all. Reporting for the news on PBCJ, I am Marlon Samuels.